Ladies and gentlemen, let me ask you something. Have you ever noticed how, as we age, the signs of our bodies slowing down can sometimes be overlooked or misunderstood? The truth is, when we witness these changes, it's not just about getting older, it's a sign that our bodies are sending us important messages. Make no mistake, recognizing these signals early can make all the difference in how we care for our loved ones during their final years. We often assume that common signs like frequent illnesses or difficulty recovering from injuries are just part of the aging process. But the truth is, these could be signals that the immune system is weakening and that it's time to shift our focus from treatment to comfort. In today's video, we're going to dive into the subtle changes that could indicate that the body is preparing for its final transition and how we can respond with the care and dignity our loved ones deserve. So stay with me, because these insights might just change the way you approach aging and caregiving. If you are not subscribed, I recommend subscribing and activating the notification bell so you don't miss any videos. If you like the topic of this video, please comment 1. If you don't, please comment 0 to let me know how I can improve and make better videos for you. Now let's begin. Number 1, significant weight loss. One of the earliest and most poignant signs that a person may be nearing the final year of their life is unintentional weight loss. At first, it may seem almost unnoticeable, a belt that suddenly feels a bit too loose, clothes that no longer fit as snugly, or an appetite that starts to diminish, leaving the person uninterested in food. Initially, many families might brush it off as just part of the aging process, a minor inconvenience that comes with getting older. But, and this is the truth no one likes to face, the reality is that losing weight without trying is rarely a good sign. It's often the body's quiet way of signaling that something more serious is going on beneath the surface. The body is trying to tell us that it is no longer absorbing nutrients the way it once did, muscle mass is quietly shrinking, and vital systems are slowing down, beginning to wind down like an old clock. As we age, it's natural to experience some muscle loss, but when this process accelerates too quickly, it can be a terrifying indicator that something deeper is unfolding. We can't ignore the fact that when the body starts struggling to digest food properly, it's often a reflection of something more profound. Whether the body cannot process protein, leading to muscle wasting, or the overall weakening of bodily functions, the impact goes far beyond a few lost pounds. The effects are devastating. This loss of strength isn't just about aesthetics or vanity, it's about survival. It makes even simple movements harder, increases the risk of falls, and, most heartbreakingly, weakens the immune system, making the person more susceptible to infections and diseases they might otherwise fight off. Every little bit of muscle lost takes a piece of independence and strength with it. It's truly heart-wrenching. But the impact of weight loss goes beyond just the muscles. There's a silent, often unnoticed shift in appetite. For many elderly individuals, hunger is no longer a priority. They don't experience the same cravings for food, and meals, once a source of joy, no longer hold the same appeal. Their sense of taste diminishes, making food seem less flavorful, and before long, they may skip meals or eat much smaller portions, seemingly without any real reason. This isn't a simple preference. It's a physiological change, a stark reminder that the body, in its quiet wisdom, knows that the time for nourishment is drawing to a close. The body no longer sends the same signals to the brain to seek out food, as if it's slowly preparing itself for what's to come. As a result, energy levels drop, strength diminishes, and overall health declines. It's as though the body is quietly surrendering, and watching it happen can feel like an unbearable heartbreak as you see the person you love slowly fading in front of your eyes. Then, we cannot ignore the role of underlying medical conditions that so often accompany this weight loss. It's crucial to recognize that weight loss isn't just a random occurrence, it's a symptom of chronic diseases like cancer, heart failure, kidney disease, or conditions that may begin their slow progression long before any other obvious signs appear. Sometimes, even depression or cognitive decline can lead to reduced food intake, creating a tragic cycle where the body simply isn't receiving enough fuel to sustain itself. For families, the temptation to try to fix the situation can be overwhelming. They may try everything, offering comfort food, encouraging meals, or supplementing with protein drinks, desperately hoping that these small gestures can turn things around. But when the weight continues to drop, even with the best efforts, it's a clear sign that the issue isn't just about diet. The body is preparing for a deeper transition, a transition that cannot be delayed or fixed with food alone. At this point, trying to force large meals into someone who is no longer hungry or able to process food may not only be unhelpful, it could add to their distress. Instead, it's about finding comfort. Focusing on small, easy-to-eat meals that bring joy and nourishment without overwhelming them is far more important. Hydration becomes a priority, and sometimes it's the smallest, most meaningful gestures that can make a world of difference in maintaining their dignity and comfort in their final days. If you notice a significant weight loss in an elderly loved one, if they're eating less, feeling weaker, and finding it harder to stay active, it's time to stop and truly reflect. This is no longer about superficial appearance. It's about the body sending a silent but unmistakable message. That message is telling you that the journey ahead is nearing its end, and it is time to prepare. Understanding this message with clarity, compassion, and patience is essential. It can guide you in making the most of every moment left, cherishing those final days, and ensuring that the remaining time is filled with love, respect, and deep, meaningful connection. Number 2, extreme fatigue and weakness. One of the most striking and heart-wrenching changes in the months leading up to the end of life is a deep, relentless fatigue that refuses to be lifted by rest. This isn't the type of tiredness you feel after a long day of work or a busy week. This is a profound, all-encompassing exhaustion that lingers and overwhelms the person's entire being. It's not simply being a little weary, it's an unshakable tiredness that makes even the simplest tasks feel impossible. Getting out of bed becomes an insurmountable challenge. Walking from one side of the room to the other takes every ounce of energy. Once effortless things like cooking a meal, getting dressed, or even holding a conversation now feel like mountains too steep to climb. This kind of fatigue is not just a natural part of aging. It's a subtle yet unmistakable sign that the body is slowly conserving its remaining energy. It's as though the body, with quiet wisdom, knows that it must preserve what little vitality it has left for what's most essential. As organ functions begin to slow down and systems start to wind down, the body starts to prioritize the most critical functions, those that are necessary for survival. The heart doesn't pump with the same efficiency. Circulation weakens, and muscles no longer receive the oxygen they once did. It's no wonder that many elderly individuals in their final months experience weakness, unsteadiness, and the inability to maintain the same levels of activity they once took for granted. What was once an effortless daily routine now feels like a laborious task, and watching them struggle with such basic actions can break your heart. Another layer to this profound fatigue is the metabolic slowdown. The body, designed to produce and use energy, starts to shift its focus as it prepares for its final phase. Instead of fueling movement and activity, energy is redirected for preservation. It's almost as if the body knows it's entering the final stretch, and every ounce of energy is reserved for keeping the essential functions running. This shift is why many older adults find themselves sleeping more, taking longer naps during the day, needing rest after even minimal exertion, and struggling to stay awake for extended periods. Some might appear fine one moment, but the next they can feel completely drained, as though the light within them has flickered and dimmed in an instant. But perhaps the most devastating aspect of this deep fatigue is its emotional toll. Many seniors who were once fiercely independent and proud of their self-sufficiency begin to feel a growing sense of frustration, sadness, and even shame as they realize they can no longer do what they once could. They feel embarrassed by their weakness, and this can lead to a deep sense of isolation. They might withdraw from conversations, avoid social interactions, and shy away from activities or hobbies they once loved, not because they don't care or have lost interest, but because they simply don't have the energy to participate anymore. This emotional and physical decline often creates a vicious cycle of isolation and sadness, making the decline even more pronounced. It's heartbreaking to see a person who was once so vibrant and full of life retreat into themselves, unable to keep up with the world around them. For families, watching a loved one go from being active, engaged, and independent to exhausted, withdrawn, and seemingly defeated is gut-wrenching. It can be easy to misinterpret this exhaustion as laziness or lack of effort, to feel frustrated, or even tell them to push through it. But the reality is that forcing activity or pushing someone to keep going when their body is telling them to rest won't help. It won't reverse the process. What truly matters at this stage is understanding their limits, showing empathy, and allowing them the space and time they need to rest. This is a moment to focus on comfort, compassion, and cherishing the time left. It's not about what they can do, it's about making sure they feel valued, loved, and supported. If you notice a loved one experiencing this kind of deep, unrelenting fatigue, especially when rest doesn't provide relief, take it as a signal that their body is undergoing a major transition. This is the time to be present with them, to honor their journey with patience and understanding. It's a time to create moments of peace, to engage in conversations that bring comfort and joy, and to support them without expectations. Because in the end, what matters most isn't how much they can physically do, it's that they feel surrounded by love, understood in their struggle, and at peace as they move through this final phase. This is their journey, and the greatest gift you can offer is your unwavering support and love. If you're still watching this video and finding these insights helpful, please comment number 2 below to let me know you're here. If you haven't subscribed yet, I encourage you to subscribe and turn on the notification bell so you don't miss any of our videos. Your support helps us keep creating content that informs and inspires. Now let's continue with our discussion. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. Number 3, increasing cognitive confusion or withdrawal. As a person nears the final stages of life, one of the most noticeable and, for many, heartbreaking changes lies in how they think, communicate, and interact with others. Those who were once sharp, articulate, and fully engaged with the world around them may begin to exhibit subtle signs of cognitive decline. You might find that someone who was once able to recall details effortlessly begins to forget things more frequently. Names, places, and even familiar routines seem to slip through their grasp. They might struggle to follow conversations or become disoriented in places they've known for years. These changes can feel jarring, especially when the person never had memory issues before. They may repeat themselves, lose track of time, or even forget the faces of their closest loved ones. These are not just minor memory lapses, they're early indicators of a much deeper shift happening in the mind. Sometimes this decline can begin months, even up to a year, before death arrives. It's as if the mind is slowly closing its doors to the world around it. It's crucial to understand that this isn't simply a case of forgetfulness or aging. The brain, much like any other organ in the body, needs a steady flow of oxygen and nutrients to function properly. But as the body begins its natural decline, circulation weakens and oxygen supply to the brain diminishes. This creates a gradual erosion of cognitive function. The once sharp mind becomes foggy. Simple tasks like making decisions or recalling a familiar face become monumental challenges. The person may start to experience confusion, loss of time, or even have moments of lucidity, followed by episodes of disorientation, as though their mind is drifting in and out of clarity. Watching someone you love who was once so vibrant and full of life struggle with their thoughts and memories is an incredibly painful process. It's as though they are slipping away a little bit each day, and the sadness of this reality can leave you feeling helpless. Along with cognitive changes, emotional withdrawal often accompanies this stage. It's heartbreaking, but it's also a natural part of the process. As the body and mind prepare for their final journey, many individuals begin to lose interest in social interactions. They may speak less, engage less, or spend long periods sitting in silence. It's important to understand that this withdrawal isn't a reflection of their feelings toward their loved ones. It's simply that their brain no longer processes emotions and engagement the same way. The conversations that once energized them now feel exhausting, and loud or crowded environments can become overwhelming. Over time, many seniors retreat into their worlds, where the noise of the outside world becomes distant and unreachable. This can be incredibly painful for families to witness, as it feels like the person is slipping away emotionally long before physically. As cognitive function continues to decline, you may also notice shifts in mood and behavior. Some individuals may become more irritable, anxious, or easily frustrated. It can be frustrating for family members when their loved one becomes short-tempered or difficult, but it's essential to recognize that this isn't just a personality change, it's the result of the brain trying to adjust to the body's natural decline. Others may become unusually calm, detached, or indifferent to things they once held dear. The things that used to bring them joy or passion no longer seem to matter, and it can feel like they've lost the will to engage with life at all. This is not a choice, it's the brain's way of coping with the inevitable. And it's important to remember that these changes are not something they can control. For families and loved ones, this stage can be one of the most challenging parts of the journey. Watching someone you care about lose touch with reality or emotionally withdraw is a kind of grief that begins long before death. It feels as though you're losing them twice. First, in the way they act and interact, and then, of course, physically. It's heartbreaking to try to reach them and find that they no longer respond in the same way. But it's important to understand that forcing them back into conversations or trying to bring them to life isn't the answer. Instead, meet them where they are. Speak gently, offer reassurance, and be present with them, even if they're no longer able to engage the way they once did. The person may not always respond to your words, but they can still feel your presence. They can still hear your voice, and perhaps most importantly, they can still feel your love. And that is something that transcends memory and cognition. If you notice that a loved one is becoming more forgetful, more confused, or less engaged in their usual activities, don't ignore it. These changes are often the first signs that the body and mind are preparing for the final transition. This is the time to be patient, to embrace quiet moments, and to create a safe, familiar, and peaceful environment. Focus less on what they can or can't do, and more on making sure they feel comforted and loved. Because even when words fail, love remains a powerful force. Even when the mind fades, the heart still remembers. And in the final moments, it's not about how much they can do, but about ensuring they feel surrounded by warmth, understanding, and peace. Number 4, frequent infections and slow healing. As the body begins its slow process of winding down, one of the clearest and most telling physical signs is a weakened immune system. You may notice that someone who rarely got sick in the past now seems to catch every cold, flu, or infection that comes their way. What used to be minor illnesses, an occasional cold, a small cut or bruise now seem to linger longer, and the person takes much more time to recover. Wounds that once healed quickly now seem to drag on, with even the smallest injuries taking an unusually long time to mend. It's heartbreaking to witness the body no longer able to bounce back the way it used to, as though it's losing the ability to defend itself. This isn't just a random occurrence. These changes are the body's way of signaling that it is no longer able to function at full capacity. One of the most concerning signs is the increased frequency of infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common. In the past, these infections might have been quickly dealt with by the body's strong immune defenses, but as the body weakens, it becomes much more difficult for it to fight back. Many families may dismiss these infections as isolated issues, but when they happen repeatedly or take longer to resolve, it's a clear signal that the body is struggling to protect itself. What makes this even harder is that even treatments that once worked effectively, like antibiotics, seem to lose their power. They might not work as quickly or as strongly as they once did, and the person may require stronger medications, longer recovery periods, or multiple rounds of treatment just to overcome infections that would have once been considered minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as effectively. It's a painful reality, one that can leave families feeling helpless, watching their loved ones suffer and struggle to recover from what used to be simple, manageable conditions. Another serious consequence of weakened circulation is the development of chronic wounds. If you notice that small cuts, bruises, or sores aren't healing properly, or if they keep reopening, this is often an indication that circulation has been compromised. Poor blood flow means that oxygen and essential nutrients aren't reaching the skin and tissues as efficiently as they once did, causing healing to be much slower than normal. Pressure sores, especially for those who are less mobile, become a significant risk during this time. These sores can easily become infected and lead to even more severe health complications if not carefully monitored and managed. What makes matters even worse is that infections in the final stages of life don't always present themselves in the typical ways. Instead of a high fever or obvious signs of illness, an elderly person may simply appear more tired than usual, more confused, or less interested in eating. These changes are subtle, often slipping under the radar. For seniors, a sudden decline in mental clarity or alertness is often one of the earliest signs of an infection, even before physical symptoms appear. This is why it's so important for families to be attuned to these changes early, as recognizing these signs can make a huge difference in providing comfort and care during this stage of life. For families, watching a loved one go through repeated infections can be an incredibly painful and frustrating experience. It's natural to want to fix the problem, to push for aggressive treatments, or to hold on to hope that one more round of antibiotics or a hospital stay will turn things around. But as difficult as it may be to accept, at a certain point, the focus of care often shifts from trying to cure the illness to simply offering comfort. Making sure your loved one stays hydrated, keeping their skin clean and moisturized, and minimizing stress on their body can sometimes do more for their well-being than another round of medications that only prolong the inevitable suffering. The reality is that at this stage, what they need most is not more treatments, but more peace. If you notice that your loved one is becoming more prone to infections, has wounds that aren't healing as they should, or seems mentally disengaged, it's time to pay attention. These are not just passing issues. They are signs that the body is losing its ability to defend and repair itself. This is when your role as a caregiver becomes even more vital, not in fighting against the inevitable, but in making their remaining time as comfortable and dignified as possible. Focus on providing a soothing, supportive environment where they can rest and feel cared for. Sometimes the greatest gift you can give them is the simple comfort of being there without the pressure to fix what cannot be fixed. As we move forward, let's shift our attention to one of the most telling changes in the final stages of life, changes in breathing and circulation. These can be some of the most profound and visible signs that the body is preparing for its final transition. You may notice that your loved one begins to breathe more slowly or shallowly than before. At times, they might even pause between breaths, or their breathing may become irregular, fluctuating between periods of rapid breathing and slow, deep breaths. Some people may experience a pattern of breathing known as Cheyne-Stokes respiration, where the breath alternates between deep, rapid breaths and long pauses. While these changes can start subtle, over time, they become more pronounced, more frequent, and harder to ignore. If you are still watching this video and find these lessons useful, please comment below to let me know that you are still here with me. In addition to breathing changes, you may also notice that circulation is weakening. The hands, feet, nose, and ears may feel cold to the touch, a stark contrast to their usual warmth. The skin may take on a pale, bluish, or mottled appearance, especially around the extremities like the fingers and toes. This happens because the body is redirecting blood flow to the vital organs, reducing circulation to less critical areas of the body. The heart is no longer pumping with the same strength as it once did, and circulation struggles to keep up. It's a painful sign that the body's systems are gradually shutting down, piece by piece. As circulation weakens, you may also notice that your loved one becomes more easily winded, even with minimal exertion. Something as simple as sitting up, speaking, or changing position may cause them to feel breathless or out of breath. Their lungs may no longer function as effectively, and fluid buildup in the lungs can make breathing even more difficult. This can result in persistent coughing, gurgling sounds, or a feeling of tightness in the chest. What may have seemed like a mild cold or congestion can be a sign that the lungs are weakening, and the person may prefer to sleep sitting up, propped up on pillows, or in a recliner to make breathing more manageable. For families, these changes can be terrifying to witness. It's natural to want to intervene, to encourage your loved one to take deeper breaths, or to worry that something urgent is happening. But in many cases, these changes are simply the body's natural way of slowing down. While there may not be a way to reverse these changes, there are things you can do to make them more comfortable. Keeping the room cool, using a humidifier to add moisture to the air, and offering small sips of water can help ease some of the discomfort. Medications or oxygen therapy may provide temporary relief, but the focus should shift toward comfort rather than trying to fix what cannot be fixed. If you notice signs such as changes in breathing patterns, cold extremities, or a bluish tint to the skin, these are important indicators that the body is conserving energy and circulation is slowing down. This is the time to be present, to offer reassurance, and to create an environment where your loved one feels safe and at ease. The most important thing you can offer at this stage is not medical intervention. It's comfort, dignity, and the reassurance that they are not alone in their journey. As we come to the end of this video, let's take a moment to reflect on the signs we've discussed: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These signs are not always obvious at first, and they may appear gradually over time. But when you begin to notice them, it's important to recognize that the body is preparing for its final transition. For many families, accepting these changes can be incredibly difficult, and it's natural to want to fight against them. However, sometimes the most loving thing we can do is listen to what the body is telling us. Instead of trying to reverse the inevitable, we can focus on making the remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death. It's about preparing for it. When we can recognize these signs early, we are better equipped to offer the care and support our loved ones need. This is a time for cherishing moments, sharing stories, and showing them that they are valued and not alone. This is the final gift we can give our love and our presence. As we wrap up today's video, I want to take a moment to reflect on everything we've covered. We've talked about the physical, emotional, and cognitive changes that often accompany the final stages of life, and how these signs can offer us an opportunity to provide better care and support for our loved ones during this precious time. These changes, though difficult to witness, can guide us in making their final days more peaceful and filled with love and comfort. Now, I want to hear from you. What has resonated with you the most from today's video? What have you learned that you will carry with you and practice in your own life or with your loved ones? Please take a moment to comment below and share the one thing that stood out to you. Your thoughts and reflections are so valuable, and they could help someone else going through similar experiences. If you liked this video and found it helpful, please leave your comment below. Don't forget to like, share, and subscribe to our YouTube channel so you don't miss out on future content. Your support helps us continue to create meaningful videos that inform and inspire. Thank you for being here, and we look forward to seeing you in the next video.